warahmatullahi wabarakatuh, and a very good day I bid to everyone. So my name is RUDAINA binti Ramdan, and I will be your moderator for today's forum. So for today's forum, we will be having a discussion about the topic of awareness of mental health issues among Malaysians. But first, let me introduce you to the panelists that we have invited for today. So firstly, we have a university student from University Malaysia Kelantan, Miss INTAN NURIN binti PADZIL. Next, an honor member of the parent community, which is Mrs. Nikno ANIESHA binti Nik Abdul HALIM. Then we have a representative of the teenager support group, which is Miss IZZATI binti YUSOF. And we also have a business friend from the company X, which is Mr. PUWENETTIRAN, son of SANDRANAN. And last but not least, we have invited a psychologist from Hospital Y, that is Dr. NURBADRIAH binti AHMAD. So that is all for our panelists for today. Before beginning our discussion about the awareness of mental health issues among Malaysians, let's know what mental health is in general. According to the World Health Organization, mental health is a state of well-being in which the individual realizes his or her own abilities, whether they can cope with normal stresses in their life, can work productively, and be able to contribute to their community. Mental health issues are a serious matter wherever you are in this world, because it can lead to many negative effects in your life. But some Malaysians do not take them as a serious matter. These awful kinds of people were making patients that suffer from mental health issues gone worse, and that is why we need to educate and also spread awareness about the serious matter of mental health issues among Malaysians. Without further ado, I would like to welcome the student from University Malaysia Kelantan, Miss INTAN NURIN binti PADZIL, to give her opinion about this topic.
Assalamualaikum and hi. Thank you to our moderator. My name is INTAN NURIN binti PADZIL. So today I will give my opinion as a student. So first, I'm going to talk factors contributing to stress, which can lead to mental health. Exams are a major cause of stress for students. The push to excel in exam brings with it a heavy school load with lots of homework, revisions and extra tuition classes. On top of that, students are also expected to participate in extracurricular activities. In the above scenario, the weaker students are subjected to a lot of stress. Demanding parents who want their children to do well also place high hopes on the children, and parents that nag also add to the stress. The students will suffer when faced with peer pressure to do well in studies as well as extracurricular activities. The push to do so much and in so many areas causes a lot of stress. When the student can't manage their stress, they will tend to feel overwhelmed by the whole situation. This feeling of being out of control can make a student feel very frustrated. It will affect the students itself. Those who cannot manage stress can become depressed and suicidal because they think that is the best solution to get out of the whole situation. Some students feel like total failures when they cannot handle the load and prefer to just give up. They do not want to try and can end up as dropouts. However, whatever the situation, there is always has way to overcome the problem. Firstly, schools should offer counseling programs. This program offer an outlet for students who are unable to talk to their parents or who do not have any adults to confide in. And through this program, it can help to identify students who are facing problem so that they can be helped before it is too late. Second, parents should introduce time management courses. Usually, time management is practiced by working adults to manage their time at work and at home. Students can use the same principle to manage their hectic lifestyle. It is because the number of hours in a day is fixed and the amount of work to be done is constantly increasing. So it is good to show students how they can manage time efficiently. So that's all from me. Thank you.
Well, thank you, Miss Intan, for your informative speech about your opinion about this matter. Next, I would like to invite an honor member of the parent community, Mrs. Nur ANIESHA binti Nik Abdul Halim, to give her own opinion about this topic.
Thank you, Miss RUDAINA, as our moderator for today. Assalamualaikum warahmatullahi wabarakatuh and good day, everyone. My name is Nur ANIESHA binti Nik Abdul Halim, and today I'm speaking here as a wife and a mother to 4 children. Okay, regarding the topic we are currently discussing, which is the awareness of mental health among Malaysians, I think society nowadays totally forgets that not only kids or teens who might suffer from this illness. Everyone could suffer from mental illness, so do the parents. Okay, in my opinion, parents are the strongest support for their children. When they are mentally sick, the whole house might be in trouble. So it is very crucial for the parents to have a strong and healthy mind to ensure their children also do not encounter this issue. Okay, one of the factors that would cause depression for a parent is the unresolved conflict between husband and wife. All marriages experience this problem, which is considered as a normal emotional response to what life throws at us and things we cannot control. It is normal until they take over our life and lead to an inability to cope with everyday tasks. This is because we keep thinking and questioning the same thing every day, and no solution is nowhere to be found. So yeah, everything seems not right and finally can limit how we live our life. Okay, so how this feeling affected you daily? It can make you lose your appetite. You cannot even think straight, and things you used to love had no impact on your life anymore. Do you know what is worse? When these issues finally lead to marital conflict and are witnessed by the children themselves, which can increase distress and anxiety across the family. The children are growing up and they should not be exposed to these emotions. It may harm their mental health and will disturb their intellectual development. So as a mother and also a role model for my kids, I always wanted to show the best side of me to them. However, sometimes I cannot help myself from being weak and unable to think clearly due to an overload of responsibility at the workplace and parenting at the same time. It is not easy for us as a parent, and today I'm here to emphasize that it is totally fine for the parent not to feel alright all the time. They also have feelings and they can be weak sometimes. But what is important, they should not be trapped in those emotions for too long. So to overcome this matter, I think the couple need to communicate more and having the heart-to-heart discussion regarding the unresolved conflict. Try to find the solution for every disputes. Furthermore, as a parent, you should create a positive home environment. Try to spend more quality time with your children and avoid showing any type of violence in front of them. So everyone, yeah, depression is just another test life throws at us. Be brave to act and learn how to walk pass through it together with your spouse. It will help you to grow stronger and more connected to each other. That's all from me. Thank you.
Thank you, Mrs. ANIESHA, for giving out your opinion as a parent. Then, I would like to invite a representative of a teenager support group member, which is IZZATI binti YUSOF, to give her opinion based on a teenager's point of view about this topic.
Assalamualaikum and hi. Thank you, moderator. I am IZZATI binti YUSOF as a representative of teen support group. So the main factor of teen mental health is environmental factors. Unlike physiological or biological causes, environmental causes tend to tend to be difficulties or stresses that um, adolescents deal with on daily basis. Environmental causes are psychological based tend to be pervasive in person's life. Environmental causes are mental illness in adolescents are typically at their core, a result of stress. Common source of stress in adolescents are social stress. Isolation or substance abuse include trauma like emotional, sexual, or physical abuse, bullying, unstable or dysfunctional home environment, for example, domestic violence in the home. Next is early loss, such as loss of a parent or sibling. So the effect from youth with mental health disorder often experience difficulties in a variety of settings, including within their own families at home, in school, and in the community. So the step to prevent this mental health is to reach out to a trusted adult. I know it is scary, but one of the best things you can do is to tell an adult what you're going through is true. It doesn't necessarily have to be a parent if you don't feel comfortable opening up to them just yet. You can reach out to a teacher, coach or other relative who you feel close to if you prefer. Next, you can use school resources. So many high school nowadays and middle schools have some kind of counselor, whether it is be a guidance counselor, psychologist, or social worker. Lastly, you should know that there's nothing to be ashamed of. For asking for help isn't something to be ashamed or embarrassed of. In fact, you should be proud of yourself for asking for help because it means you are brave enough to take the first step in getting better and make change in your life. I think that's all from me. Thank you.
Thank you, Ms. Izzati, for your speech. Now, moving on to our businessman for today, which is Mr. PUWENETTIRAN. Please give out your opinion about this topic.
My name is Punindran Sandranan. I'm the businessman. The main factor that causes mental health is lack of control towards business. As a businessman, the leading factor that we face with mental health because of lack of control in business. We cannot just always focus on the businesses because sometimes we have to focus on the employees who working there and then their behaviors also for keep the company's progress well and stable. And the impact from the lack of control and the mental health is this thing is cause blood pressure and rise in and our confidence also wane. These problems make us and give us some many health problems and mental health problems. At the same time, businessmen also getting stressed and also they also face with many challenges. And there is a way to overcome this problem. As a solution to this mental health problem, as a businessman, we need to go for holiday or vacations to reduce the stress and emotions. Moreover, we also need to take some naps sometimes for making our bodies fresh and good.
Thank you, Mr. PUWENETTIRAN, for giving out your opinion about this topic. Now we are moving on to our last panelist for today, which is Dr. NURBADRIAH, to give her opinion about this topic as a psychologist's point of view.
Thank you, Ms. Zaina. Good day, ladies and gentlemen. My name is NURBADRIAH binti AHMAD, a specialist from Hospital X, and the last panelist for today's forum. As we all know, there are many types and classes of mental disorders, and the situations that our panel shared just now can be classified into depressive disorders. These kind of disorders affect how you feel emotionally, such as the level of sadness and happiness, which later may disrupt your ability to function. After the diagnosis, treatments focusing on easing the symptoms are run, depending on how severe the patient's condition is. For example, prescription medications such as antidepressants, anti-anxiety medications, and antipsychotic medications, Psychotherapy and lifestyle changes are recommended for these patients. Besides that, there is also trauma and stressor-related disorders where a person has trouble coping during or after a stressful event. Examples include post-traumatic stress disorder, PTSD, and acute stress disorder. This kind of disorder can occur after witnessing or experiencing a disturbing event such as physical and sexual assault, domestic violence, natural disaster, war, and even accidents. Uniquely, the symptoms are likely to appear several weeks or months after the event, after all physical scars have likely healed. As the symptoms are quite similar to depression, many confuse them both and thus some even misdiagnose. Most doctors would likely prescribe medications and talk therapy to ease the symptoms, tamp down emotional reactions, and eliminate crippling avoidance. There's also psychotic disorders, for instance, schizophrenia, which causes detachment from reality. The patient suffers from delusions, hallucinations, disorganized thinking, and speech. Meanwhile, paraphilic disorders, which include sexual interest that causes personal stress impairment and could potentially harm another person. The examples are sexual sadism disorder and pedophilic disorder. These severe or harmful disorders requires the patient to receive treatment in a psychiatric hospital as they may harm themselves or someone else. The hospital may offer 24-hour inpatient care or residential treatment and intensive outpatient treatment. If medications and psychotherapy didn't work, brain stimulation treatments are another options given. However, it is a bit risky as it may include side effects such as infection, stroke, and headache. Although downwards treatments are suggested, do keep in mind that they are only ways to provide durable symptomatic relief and may not be able to eradicate the disorders. That's all from me. Thank you. I'll pass it to Miss Diana again.
Thank you, Dr. NURBADRIAH, for giving out your opinion about this topic. Sadly, we have come to an end of our forum for today. I would like to thank you all to all the audience that joined us and also to all the panelists for giving their cooperation for our forum for today. And we hope the inputs and information that we discussed today are beneficial to the audience and also to the public. Remember that you are not alone and take care of yourself. So that is all from us. Thank you.